Good morning, Peter Goertz. I'm a psychiatrist. Is being a psychiatrist going to drive you crazy? I don't think so. That's nothing you have to be concerned about. And is psychiatry a desirable career? The short answer is yes, absolutely. I can't think of any more fascinating field, and it's a privilege to meet so many different kinds of patients, people, colleagues, friends of patients, etc. So that's the short answer. You're going to make a good salary as a psychiatrist in the US. At this point, you're going to be making about $200,000 to $300,000 a year. The quality of life is good. You're going to be maybe working a 40-hour work week. In certain jobs, you're going to be on call. Like in my job, I'm on call on the weekend about every 2 months, and I have to go into the hospital for Saturday and Sunday. But I work with the resident, and they do a lot of the work. And either way, though, your quality of life is going to be good. You're not going to be staying up all night with patients in general. Rarely that may be the case if you're on call. And there's a big demand for psychiatrists. So your services are going to be needed pretty much, I think, in any country, wherever you are. You're going to see patients get better. One example is a young lady, 19-year-old lady, I think, came to me when I was in private practice years ago, and she was having panic attacks. She recently had developed panic attacks, pretty severe, very disturbing panic attacks. But after a session or two, as soon as she became aware of her anger, and specifically her anger toward her mother, and digested that, at least a little bit, the panic attack stopped without medication. So there can definitely be improvement, even quite quick improvement in patients' states of mind, and that can be very nice to see. And you can see patients admitted to a psychiatric hospital after a serious suicide attempt. A week later, when they're discharged, no suicidal thoughts. So people definitely get better, and try not to be discouraged when people look really out of control and devastated, severely depressed, suicidal, etc. Things definitely can shift. Not always, but they can. Now, in psychiatry, there's been less and less psychotherapy done by psychiatrists, let's say over the last 30, 40 years. But it's still possible, and I myself do about, I'd say 20% of my clinic patients I see mainly for psychotherapy. And there's really, in my opinion, something to be said for one person doing psychotherapy and medication management, both of them, because then the patient does not have to see two people. Everything is done by one person, and one hand knows what the other hand is doing, which is a big advantage for patients and for you, because you don't have to wonder what the psychotherapist is saying or what they're talking about. Even if you read the notes, you may not get the whole picture. And also, you get to really address all sides of the patient, the medical side and the psychological side. So that for me is a lot of fun. And I think it really probably overall is less expensive if one person does both. But nowadays, that's not that common. You're going to have to know a good amount of psychopharmacology, internal medicine, neurology. So you do have to study, you have to have medical knowledge. You're going to have to deal with a lot of bureaucracy. Every single visit with the patient, you're going to have a lot of clicks you're going to do on the computer. You're going to have to deal with danger. Patients potentially can assault you, especially on inpatient wards when they're admitted really out of control. Patients can commit suicide in the hospital, outside of the hospital. Those are all realities. So these are things that are part of a career as a psychiatrist. Not pleasant things, but they are things that come with the territory and that you can work with and cope with as a psychiatrist, in my opinion, without saying, oh, that career is not for me. You're going to have to deal with people who are chronically ill, for example, chronically psychotic patients who've taken, let's say, 20, 30 medications over the course of their life, and nothing has really resolved the psychosis. They're still hearing voices. They're quite troubled. They're not able to work, not able to go to school. They're barely able to stay out of the hospital, which is still better than if they're frequently hospitalized. So sometimes you just have to be accepting and realize that, okay, at least they haven't been hospitalized in the last 2 years. They're not working. They're not able to go to school. They're not really happy. They're troubled by the voices. But still, at least they're not being hospitalized. And even if they are hospitalized, as psychiatrists, you're going to still have to do your best and cope with that. And in my opinion, that is doable. You know, it's a balance because you get patients who are success stories, if you want to put it that way, and patients who are chronically very troubled. You're going to have to deal with involuntary treatment, which is a real challenge for me. In the long run, in my opinion, treatment has to be voluntary in order to be effective and in order for patients really to benefit from it. But in the short run, I don't have any alternative. If someone is acutely suicidal, homicidal, absolutely unable to care for themselves, not eating, not sleeping, dehydrated, then I don't see any alternative to involuntary treatment. So people will have to be hospitalized involuntarily. If they're agitated, they're going to get injections involuntarily. So that has never sat well with me. However, in my opinion, it is at times necessary, and it's part of what you have to cope with as a psychiatrist. Nowadays, since COVID especially, there are more and more virtual visits, and I enjoy them. I prefer in-person visits because I like to often examine the patients. You know, if someone's on a stimulant like Ritalin, you want to check their heart rate, you want to listen to their heart. If someone is on an antipsychotic, you want to check for stiffness, shaking. So all that is addressable in person, but not so easily addressable if you're not sitting with the patient, if it's a virtual visit. But a lot of the visits nowadays are virtual. I'd say about 40% of my clinic visits, maybe 30% now, are virtual. And another aspect is you're going to learn about new treatments like ketamine, for instance. There's transcranial magnetic stimulation. So you're going to be exposed to new treatments. And another aspect is medicine and hospitals and clinics are nowadays being run as businesses, at least in many cases. So, and you can tell that by the terminology. So people talk about providers and clients instead of saying doctors and patients. And to me, that feels like people are thinking, potentially at least, about money instead of about suffering. You're going to hear, if you're working as a psychiatrist and probably in any job in mental health, you're going to hear about productivity, in quote. So the administrators are going to be happy if you see a lot of patients in a certain amount of time. That is not always the best thing for patients. You want to take your time often. You want to do the legwork. You want to check their chart in detail. You want to look at the lab work. You want to look at the medical part. So so-called productivity is not necessarily better than taking more time, and spending more time on each patient. Another aspect that's enjoyable in psychiatry is your colleagues. You're going to have contact with social workers, psychologists, nurses, other psychiatrists, other doctors like internists, surgeons, emergency room physicians. You're going to have contact with many patients, the patient's family members, the patient's friends. So you're going to have a wide variety of people you're in contact with. And again, that's a privilege to me. You're going to be learning a lot from having interactions with many different people from many different walks of life. So bottom line, as a psychiatrist, you're going to be exposed to a wide range of humanity, and it's very fulfilling. Thank you.